Hi, good morning, everybody. My name is Suzanne Hamouda. I'm the head of the health informatics team at Malaffi. And on behalf of the whole Malaffi team, I'd like to warmly welcome you all and thank you for your time for joining us today. It's a pleasure to have such a diverse group of clinicians and healthcare leaders with us. Your engagement and feedback has helped play a pivotal role in shaping the evolution of Malaffi. And today's forum is another opportunity for us to work together to improve healthcare across Abu Dhabi. And today's session's intended to be interactive. We'll share the latest updates, we'll showcase new capabilities, and we'll also discuss the upcoming initiatives that we have. And most importantly, we want to hear directly from you. Your insights have always helped us ensure that we build a healthcare system and a solution that meets your needs and helps you in your day-to-day work. With that, I'd like to introduce our chairpersons and our esteemed guests for today's session. First, we have Dr. Mustafa Abdul Latif, who I think a lot of you have already seen at the beginning of this call. And he's a senior health informatics specialist at Malaffi. With over 10 years experience, he specializes in EMR implementations, public health initiatives, and leverages healthcare data to do the digital transformation and improve patient outcomes across the UAE and Qatar. Joining him as a co-chair, we have Reshma Veerapan, who is the health informatics specialist at Malaffi. He has over 15 years of experience in healthcare, specializing in digital health implementations, clinical adoption, and advancing health information exchange across the UAE. We're also delighted to be joined by two very special guest speakers who will be sharing their experience with us on using Malaffi. The first guest speaker is Dr. Bakr Sadoun, who is the project manager of patient safety advocacy and risk management at the Department of Health. Dr. Bakr is a physician and a health informatics leader with experience in digital health transformation and healthcare quality and clinical data standardization. And our second guest is Dr. Mohammed Abdul Razak, who is the medical informatics director at MediClinic Middle East. He leads clinical informatics across 6 hospitals and 27 clinics in the UAE. He's a physician by background and specializes in EHR transformation, clinical AI, and integrating digital health solutions into frontline care, both across private and government healthcare networks in the GCC. So thank you again for joining us today and for your continued support in advancing connected data-driven healthcare. And without further ado, I'll now hand it over to Dr. Mustafa.
Thank you so much, Suzanne. Thank you for the introduction. Good afternoon again, everyone. Thank you so much for deciding to spend your afternoon with us. It means a lot of us. As Suzanne said, this is our second physician annual forum. Inshallah, we'll try to make this as a habit as possible to hear the market. In terms of the interaction, just for the sake of a comfort for everyone, the mics are disabled as well as the cameras. Throughout the sessions, if you have any question, just feel free to raise your hands. We will enable the mic for you so that you can unmute yourself and then have the interaction with us. We do have today a time allocated for the questions and answers. And without further ado, I'll take you through the agenda of what exactly we will be covering today. So the introduction, that's what basically Suzanne told us, that today we will be looking at whatever we have done, new features in terms of the Malaffi provider portal, where we are incorporating some real use cases in terms of the AI intelligence. We want to hear also from Dr. Bakr as Dr. Mohammed Abdul Razak. We have a short demo for you in terms of what are the features that we are starting to add in Malaffi, how this will help you, what was the regulator vision and ambition behind those features to adding in the provider portal. After that, we will hand it over to Reshma, to co-chair with me and with our esteemed guests a panel discussions through some interesting topics. Then we will open the floor for you. Feel free to interact with us also during the chat. We are monitoring the chat and we'd be more than happy to answer any question. And as I said, at any time where you feel that you need to have a questions, please raise your hand. We will enable the mic for you. You will be able to unmute yourself. And then after that, you will be able to unmute yourself, ask a question. I'll be more than happy to hear your thoughts and hear your ideas about how we can do things better. The first thing that we want to tackle today is the wellness. Now, Malaffi started in 2019. That was our first go live with our first healthcare providers, starting with the key and strategic providers. And now we are connected to all the healthcare market of Abu Dhabi. Now, if any one of you were following us and following the journey of Malaffi from the start, we know that we have come so far. We are connected to more than 3,000 plus facilities, more than 93 different and unique electronic medical records. Now, this was the aspiration and basically the main core and the nucleus toward where we want to take Malaffi. We are continuing to expand our features. We are continuing to expand our standardization as well as enriching our clinical data domains, demographic data domains, in terms of basically being able to act as an enabler to our regulator, the Department of Health, ADPHC, Abu Dhabi Public Health Center, and also recently HLU, which is the Healthy Living Unit Abu Dhabi, toward multiple features. One of the main things that we want to start tackling is the patient wellness panel and the idea of the patient wellness and the prevention. Now, this stems from the fact that, as all of you know, that the official app developed by the Department of Health, in also with Abu Dhabi Health Data Services, which is Malaffi is under, is the Sahatna application. The Sahatna application has opened the gate for us for multiple things, multiple initiatives, and has allowed us to have more data points and more data domains when it comes to the patients connecting their own wearables, allowing us to get more on information and more on insights. And because we don't want this information to be siloed, in the essence of Malaffi as a health information exchange, we think exchange first, enabling for our healthcare providers the clinical data. To do this, and in line with our Department of Health, our regulators, we have started to develop a new page, which is a patient wellness page. And the patient wellness page is primarily looking at comprehensive patient overview, meaning that we are getting information from across the provider portal, which is our landing page and the platform, which is accessible by different healthcare providers through different roles and responsibilities across the healthcare facilities in Abu Dhabi, and putting it in one place. Basically looking at certain and primarily biomarkers that is attached to the wellness, attached to the longevity of the population, having information that comes from a physical activity of the patient to show it in the provider portal, meaning that the physician now is having a holistic overview of the patient wellness parameters, meaning that if I'm working out and I have already basically connected my wearable, connected my health app to the Sahatna, now I have an assurance that my physician have an idea about my physical activities and what exactly the other biomarkers that I'm running through. And as you notice from the screenshots, and I will take you through a live demo, I don't want to talk more about the in the look of aesthetic screenshots. We have added a few things as well. We have added the clinical summaries, which is an AI-powered insights, which is primarily a pre-prompted summary for the patient. As we know from our experience in the informatics fields, one of the main important challenges and the pain point that could actually overwhelm a bit of a provider is where do I look for the information? The more information we have, the better. However, sometimes with the sheer amount of pressure that we have on the healthcare providers, sometimes they don't have the time and the luxury to be able to navigate through the patient profile, and they want things to be as snappy as possible. And to do that, what we have done is that we pre-prompted the patient profile, having an AI insight to show a clinical summary. Now, without further ado, I will just start sharing my screen in terms of showing you exactly what we are looking at in terms of a live demonstration of how the provider portal looks like. I will need an assurance with my colleague Reshma that my screen is visible to everyone.
Yes, it's fine. consent.
Okay, great. Thank you so much, Rishma. So what we are looking at here is a page that you always, you all actually are familiar with, hopefully that you love and you interact with on a daily basis. This is our provider portal in Malaffi. This page is the new developed page, which we call it patient wellness. The patient wellness page takes multiple sections, multiple containers of clinical information, starting with the right side with a clinical summary. In the clinical summary, this is a pre-prompted where we have in the back of it a large language models, which looks at the patient profile in a holistic way, gets pre-prompted and generates for you a clinical summary in a concise way, direct to the way, and then through careful prompt engineering, we were able to surface the key important information for you in a bit of a snappy way, in a place where it doesn't really require you to navigate through multiple pages. And of course, this is primarily a high-level approach. You would always have all the other features in order to deep dive, in order to have a more granular level of a clinical information, if that is needed, of course, in your daily practice, and apologies, and in the consultation. On the left side, we grouped for you the biomarkers, and under the direction of the clinical leaders in the Department of Health, we were able to qualify certain importance biomarkers that qualify for the wellness and for the longevity, and put them to you, wrap it for you in one place, showing you the latest results that the patient is having and categorizing it into different categories, such as bone and mineral categories, endocrine, cardiovascular, as well as the hematological, hepatic, and so forth. On our right side, under the clinical summary, this is our physical activities. The physical activity, this is what basically is coming from Sahatna. So now me as a patient, sorry, me as a physician, I am now empowered to look at the physical activity and know exactly how active is my patient is. Do I need to have any basically do I need to advise them to move better? Do I have an idea about how they are performing in their day-to-day activities? And of course, the aspiration is to have more information that will come from the wearable. The steps, the moderate exercise and the vigorous exercise were our nucleus, our core, and our backbone in order to start building on it. Something else that we added here is the immunization. And this was just a start. One of the aspiration that we want to have in the patient wellness in the concept of having a health maintenance. And what do we mean by the health maintenance is primarily showing a panel for the doctor, a place where they will know what are the screenings that the patient is due for, what are the screenings that unfortunately the patient was not able to perform or undergo, so that they could remind them. Needless to say, something like breast cancer, God forbid, colorectal cancer, lung cancer, and so forth, and then starting to develop more on the health maintenance. And the idea of it is prevention first. We have all the clinical data. Now, how we can make use of this clinical data, all this sheer amount of data that we store in Malaffi, in order to start having some clinical rules that will tell the physician what to advise the patient for. And one major thing that we were able to add in terms of the wellness is the maternity journey. Notoriously, this can't be done normally in an HIE, in a health information exchange. On an EMR level, this is pretty much a module that exists in any healthcare facilities that actually do have and offer the obstetric services and the maternity services. However, from an HIE perspective, that's not an easy. Thanks to our data engineers and thanks to our developments, we were able to basically ship for you and have it wrapped in a nice wrapping, a whole maternity journey, where basically we look at the patients. If the lady is currently pregnant, what is her gestational age, regardless of where she's following up into her antenatal care, showing us how far she is in the journey of pregnancy. And then if that pregnancy is having, or it's a multiple gestation pregnancy, showing also the doctor the key scans of the obstetric, the key scan of the first trimester obstetric of the ultrasound, the second trimester and the third trimester, showing the doctor if the scan was done and not done. And of course, this is across the healthcare of Abu Dhabi. And because of the importance of other things that is related and other parameters that is related to the maternity journey, we are showing you as well the past obstetric history, showing you all the obstetric histories, if it, God forbids, ended with a termination in the unfortunate cases, or if it ended up with delivery, what was the start date of this pregnancy? What was the gestational age of the end of pregnancy? This was possible during to be honest, thanks to our developer and thanks to our data engineering team, we were able to do this on an HIE level. That wasn't easy, but thank God. And we hopefully that you will make use of it. And we would love to hear your feedback of how we can improve this page, what we can add more parameters. And last but not the least is the mental health assessment, showing us here the mental health assessment that was done for the patient, what was the score, the interpretation based on the standards of the definition of the interpretation of a score from a PHQ-9 and GAD-7, when was this done, and for the facility. And rest assured, as always, anything that is related to mental health, anything related to a sensitive information, it is already covered behind our privacy seal, similar to what you know about Malaffi from the start, what you know about the platform that you have been using. That will be it from a live demonstration point of view in terms of our patient wellness. If you would allow me, I'll share the screen again to go back to the presentation to carry forward for the forum for today. I know that we have few questions on the chat. We will have time to go through it. Now we move to the Malaffi AI physician assistants, and here we will give the mic in a few minutes to Dr. Muhammad Abdul Razak from MediClinic. The idea of the Malaffi AI physician assistant is an AI-powered physician assistant where the doctor can quickly get information such as summarizing the patient profile, asking question about the sheer amount of clinical data that is there on Malaffi, which could aid them again in the rapid access of the insights. So if you notice, what we are trying to do here is that we know we have an extensive amount of data. We want to make sure that the doctor can get access to the data in the fastest way possible. Our aspiration to the AI physician assistants is big. We will soon incorporate more clinical content to it, more clinical guide on it. Consider this as some sort of an information about what to come on the physician assistants. We do have big plans for it. And later, inshallah, maybe in the next few months, you will start receiving an announcement of how the LLM actually improved and how exactly and what we are doing in that essence to improve the basically usage of the LLM. It's primarily, as a gift, a chat box. We have it in our quick reference guides. Please reach out to us. We will leave in the end any communication. Reach out to us if you have any difficulty on how to use that. That will move me to a testimonial video from Dr. Muhammad Abdul Razak that I will be playing in terms of him explaining to us how he's using the Malaffi AI physician assistant in his day-to-day operation. I'll play the video, and here you go. Thank you so much, Dr. Muhammad, for recording this video with us, and also for the other physicians who were in the MediClinic video. Dr. Muhammad, I would like to invite you to take the stage, tell us a bit of the MediClinic experience of the utilization of the physician AI assistants, and what we'd like to hear from you, from your insights. How did this help you in your day-to-day operation? I'll leave the floor and the mic to you, Dr. Muhammad. Please go ahead.
Thank you very much. Thank you. And thank you very much for the invitation here. It's a pleasure to be speaking to everyone. With regards to the LLM specifically, I think it's really been a great use for the physicians within MediClinic. And I say this because it falls in the right place within where the LLM should be. So a lot of organizations do have some LLMs within their EHRs in the last recent year, but the advantage that falls within Malaffi is that the LLM sits at the health information exchange level, at the longitudinal history of the patient. So you're looking at not just the data, or the LLM is not just looking at the data that's available to you within your own EHR, but it's looking at the entire patient record and providing you with those summaries and lab results and information that you need to access. A lot of summarization is helpful, particularly for patients with long histories where you need to, especially if you're seeing that patient for the first time and you want to have a quick understanding of their problems and what's been going on with them for the last few years. And it also helps a lot with navigation. So rather than spending a lot of time with multiple clicks trying to find the right lab result and trying to find the right radiology image result that you were looking for, you can quickly just type in the prompt and get the result that you want. And that makes things a lot easier. When you're in a busy clinic, you don't want to spend time navigating through multiple clicks and trying to find the information that you're looking for. The information comes to you, available to you at your fingertips, and then you make the right information with it. So in that aspect, I think the LLM has been a great benefit to our physicians at MediClinic.
That's great to hear this, Doctor. That's great. That's great. Without further ado, Dr. Muhammad, thank you for this. I'll hand on the mic to the co-chair for us from our side, Rishma. The floor is yours. Thank you so much.
Thank you, Dr. Mohammed and Dr. Mustafa, for that insightful demonstration and the discussion points around our AI features within Malaffi. We've all just seen how AI has the potential to transform the way we access patient information and to support the clinical decision-making. However, AI is just as powerful as the data behind it. Every clinical note, every diagnosis, every piece of information that we enter within the patient's health record contributes to something bigger other than the single encounter of care between a physician and a patient. So with that said, I would like to turn to our clinical experts, Dr. Mohammed and Dr. Bakr. From your perspectives, how does data impact the bigger ecosystems within your respective environments? We can start with you, Dr. Mohammed, and then we will move over to Dr. Bakr.
Sure. I think when a physician documents a visit and they're sitting in the clinic, they're usually just thinking about the patient that's in front of them right now and what they need to document for that patient. But I think what's important to consider is that they're doing something much bigger at the same time. They are contributing to that longitudinal history of that patient. That patient's data is available not just to him and not just to the physicians in his organization, but it becomes something that's available to all healthcare professionals and different organizations. And so you are slowly building that lifelong longitudinal record of that patient. And that information can help improve the patient outcomes for a patient, maybe not today, maybe not in a month, but somewhere down the line, some doctor is going to need that information that you've entered, and it becomes invaluable to them. Everything that we record, for example, at MediClinic, when we have a patient visit, we record the information inside our EHRs, and that information doesn't just sit within our own EHR. It flows out to Malaffi, and from there it goes to other organizations, and they can see it. So if this patient goes into an emergency department 6 months down the line, he's unconscious, that emergency physician has a lot more information and a lot more understanding of what's going on with the patient to make the right clinical decisions for him at that point. So I think that's a great advantage. And then secondly, it's the value of that data, right? So everything that Malaffi can do for us as clinicians, as patients, the ceiling for that value only comes from how well we input our data, right? So if we present accurate data and the data is correct and standardized and in the right way, and other organizations are doing the same, then we all benefit collectively as clinicians, and the patients benefit. And in the end, I mean, the end result, sometimes it's very easy to get sidetracked with the technologies and the uses and everything, but really everything that we're doing, everything that Malaffi is doing, everything that we do for our patients, there's one goal: to improve the patient's health and improve patient outcomes. That's the one goal that we're all working towards. So having that data provides you with that ability.
Amazing. Thank you for that, Dr. Mohammed. Dr. Bakr, over to you.
Well, yes, thank you. Well, yeah, I want to echo Dr. Mohammed. So Malaffi give us a great tool. It's a great platform where we have an holistic information on the patient. So having all the information in one place, giving all the longitudinal view of that patient, covering all the aspects of the healthcare within Abu Dhabi ecosystem. Yeah, primary care, secondary care, tertiary, inpatient, outpatient, emergency. On the top of that, having the AI on it, so we can question that on the platform and get a quick summary. We understand as a department of health that giving the right tool to the physician will basically to empower, it will enhance the care, it will empower them, it will ensure continuity of care, and also it will ensure that we are providing a safe, a well-supported, informed decision in our care. So I see Malaffi as a great tool, and we need to utilize it more and more. And as stated before by my colleague, the most important is the data. We are relying on your data. So when you document, it's moved to Malaffi. Malaffi currently have a lot of data sets, has a lot of information, and we are building more and more on the top of that. The main purpose, again, is to expand how much knowledge, how much information we have on this patient. We can provide a better care. The better care can be at the patient level, and as a DOH also we are looking for population level. So we are targeting many projects, many initiatives to enhance the population, utilizing all the data, utilizing all the insights that we currently have within Malaffi based on your data. Thank you.
Thank you, Dr. Bakr. Thank you, Dr. Mohammed, for those valuable insights. So we've just heard how data forms the foundation of a connected healthcare ecosystem and improves the overall health of entire populations, actually. Dr. Bakr, I know that you have spoken a little about data and data quality. What opportunities do you see that leverage AI for population health management and screening programs?
Well, as stated, health AI is a very useful tool. It can have many use cases. But the main and core of the AI is the data sets. What data we have, how structured is it, how complete is the data, and in how many data points that we are getting. So we need to ensure all of this is completed. The use cases for the AI, of course, it's a lot. We started for the first use case, which is basically the physician, let's say, on a prompt where he can get a quick summary. So this is a standard. We are also working on a lot of things. We are working on population health. We are working on an early stratification of the population where we can target the specific DOH and the ADPHC and the programs to enhance the level of care and to do more and a proactive care other than a reactive care. Imagine that with all the knowledge that we currently have, we can do a more let's say, a more intelligent invitation for a patient. We can target the patient that we need them because we have more and more data sets. So we can now, we can safely identify the high-risk population. And that will improve our screening efficiency. It will improve our resource utilization. And of course, it will enhance the clinical outcome. So all of those depend on the data. And the other things that of the AI. So we talk about the end users, we talk about the screening and prevention. Also, we need the AI will help us in closing the gaps. Imagine how many cases we saw as a physician where we do the tests and then we find there is abnormality, but then basically the patient, he didn't come for follow-up. All of these care that we refer the patient to a place and then he doesn't go to that appointment. So AI will help us to close the gap across the Abu Dhabi ecosystem. It will help us identify who the patient who missed the screening, who missed follow-up an appointment, who have, let's say, abnormal diagnostic tests, who didn't do an action on it. All of those are use cases, and we are working on it. Early detection, we work on that. So imagine that we are doing screening programs as well, but we have a lot of data is already available in Malaffi, where we can utilize to be analyzed, and then we identify patterns and new patterns for screening. Imagine, let's say, an X-ray or a CT scan. All of those can be utilized for early detection, for enhanced care. Before the patient approach the facility, based on existing information, we can target and identify the high risk people, and then we target, let's say, the resources, and to ensure we have an appropriate care giving to them. So the future of the healthcare is basically, it's not about data. We need to have the data in the right form. Then again, we segregate it. We want to convert and we want to transform this data into an intelligence. And then we use all of these intelligence and all of these knowledge to enhance the care at the patient level, at population, and also at the population level.
Amazing.
Thank you.
Thank you, Doctor, for sharing your perspective. I think we've all gained a deeper appreciation for the role that data and AI is playing in transforming healthcare in and across the Emirate. Thank you so much, Dr. Mustafa. I'll hand over to you.
Thanks, Rishma. Thank you so much. Thank you. Thanks a lot. Dr. Mohammed, so where is the issue? I mean, everything that we are hearing about AI sounds great. Everything that Dr. Bakr also told us sounds great. I mean, everything is cool. So what are the barriers? Where are the issues? And what are the barriers in the AI adoption across healthcare organization? What would you think about that?
Well, it's a good question, and it's a bit of a tough question to answer. But I think in my experience, when a lot of people, they ask why hasn't AI transformed healthcare as quickly or rapidly as it has with other industries yet? And most of the time they assume that the problem is the technology itself. But in my experience, most times it's not about the technology. That's not really where the barriers lie. But I think the first thing would be the data itself. So with AI, I think we've covered this, but I'll reiterate it because I think it's very important. In AI, data is everything. And I don't mean just any data. It has to be clean, structured, and clinically meaningful data. Most organizations you look at, and they'll tell you, yes, we have plenty of data. The data is right there. But then you look a little bit more closely, and the data is scattered across multiple systems. It's buried deep in free text, in PDFs, and it's not the right way to approach the AIs. Any AI will only be good as the data that you give it, regardless of what model or language or algorithm that you're using. Think of it like cooking. Even a world-class chef wouldn't be able to make you a great meal if you don't provide him the right ingredients to work with, right? So you need to start with the data. Anytime that you are thinking about implementing an AI tool, the first thing you need to think about is our data ready? Is it Is it there and is it available in the right way? The second thing I would say is trust. And this doesn't just apply to AI, it applies to any new technology. There's always a little bit of lack of trust when it comes to trying to implement something new. And physicians, in general, I'd say we are generally cautious people. We're trained to be cautious as part of our medical training. So you tend to ask questions, right? Okay, this AI gave me an answer. What is it based on? On what data did it give me this answer? So there are questions about, should I trust this new tool to help me treat patients? The way I think about it is this, though. With AI, it's sort of like having a new intern in the hospital. When you have a newly graduated doctor and you bring them in, you don't, yes, they're doctors, but you don't just give them full independence and let them do whatever they want and make any decisions you want. You start giving them small tasks under your supervision. You see how they're doing, and as they improve, you start giving them bigger tasks, and then you see how they're learning. And that's, I think the same applies with AI tools. Start small, you start with the right tool, you observe, you supervise with human guardrails around it. And then as you see it improving and as you see the outcomes getting better, then you can start expanding. So I think with terms of trust, there needs to be a little bit more trust with the technology, with the right guardrails around them. Thirdly, I'd say, and in my opinion, I think this is a big one, the workflows. I think sometimes we are so entrenched with the technology and the AI and the tool, but we fail to integrate it within the right workflow. Any AI tool that we bring in, regardless of how good it is, it needs to fit into the clinician's workflow, right? If it's just another additional screen and an additional login somewhere else that they need to do, then it becomes harder to adopt and harder to work with. So it needs to sort of be it needs to show up in the right place at the right time for the right person and give them the right information that they need to take the right actions for their patients. It's like a sepsis model that predicts my patient will deteriorate. But if it predicts that after my patient is already in an ICU, then that's sort of like me being in a car and having a GPS telling me to turn left after I've already missed the turn. Technically it's correct, but it's a little too late. So it needs to fit the workflows in the right way. Lastly, I'd say the people themselves, and I think that's an underestimated one. We tend to think of AI as a technology, but we need to start thinking about it as a clinical tool. And so you need to start involving, when you want to implement a new AI tool, you need to involve clinicians early on, because they understand the workflow, they understand the pain points, they understand what they need in order to get the right things done for their patients. A lot of times what I see happening is they build these beautiful, complex AI tools, but what happens is the clinicians weren't involved from the beginning, and you end up beautifully solving the wrong problem that wasn't needed to be solved to begin with, when it could have been addressed earlier on. And it also helps with trust. When you involve the clinicians early on, they understand how these tools work. So they understand what data they're using to give you the outcome that they're giving, how is it working, and so the trust and adoption increases with them. But it becomes very hard to do that if they don't understand how this tool is working, or what its limits can do, what it can do and what it cannot do. And I think lastly, I would say governance. And I think governance within AI it's still rapidly developing, but it needs to be there. And I think the UAE and Abu Dhabi specifically are already ahead of most of the world when it comes to this. But you need the right guardrails to make sure that what you are doing is done in a safe way. You need to know, where is this data that you have is living, where is it going, where is it sitting? Does your vendor have access to this data? Who is being able to access this data to train models on? All of these guardrails around governance need to be put in place so that when you implement the AI tool and it's being used on patients, real patients, it's falling in line with the right regulations and the right safety parameters that need to be in place for patients.
That's great, Dr. Mohammed.
For a little too long there, sorry.
No, not at all, not at all. Would love to hear from you. Always great insights. To be honest, Dr. Mohammed, I'm glad that you brought up the data quality. And before I move to the final question to Dr. Bakr, I'm glad you brought in the data quality, and this is something that we have been taking to really seriously in terms of the Malaffi and in particular the health informatics team. As you know that last year during the AGCC, we were recognized as a global reference for SNOMED. We are pushing the long standardization. We have our own data quality initiatives. Maybe some of the participants and the healthcare providers who are with us in the call start receiving those monthly reports on their data quality. I hope it's not an overwhelming, but trust me, it is for good use, like what Dr. Mohammed is saying. And great choice, Doctor, of the examples around the chef at the time of the lunch. So that's why we don't want to keep people. We are noticing the chat. There is a lot of questions and marvelous questions. Hence, I'll just ask the final question for Dr. Bakr before we cater for the questions on the chat. Dr. Bakr, from a regulator perspective, now we heard from Dr. Mohammed the barriers, and maybe we can take this into consideration, our next AI initiatives that will be supported from the Department of Health. Now, from you as a stakeholders, as a regulator, and of course, privacy, data security is one of the main concerns from the Department of Health, even before the era of the AI. Now, with a lot of AI tools, a lot of interactions, what do you think that basically we need to do to ensure that our patient privacy, our data security, it's in place while utilizing multiple tools that are available? Would love to hear your thoughts on that.
Thank you, Dr. Mustafa. So the Department of Health have a big department for the InfoSec requirements. They do assessment for all the requests. So, and of course, Malaffi, they have its own version as well. We comply with the government regulation. So there is a robust mechanism to assess the information, where it's going, who access the information, it's stored where, even any AI engine, where he accesses it, how much information is going to the engine. It has to be as minimal as possible without any patient identified information. So many restrictions and many regulation has been placed in order to ensure the patient data is basically well protected, it's secured, it's located in a governance location with a Malaffi. The access for this data is basically well monitored, and it's basically access-based. So you need an authorized physician, a licensed physician by DOH or our clinical profession. So the Malaffi, they implemented already different levels of access based on the license. The break the glass functionality is available. It's enabled only for specific positions. So an role-based access is already there. It's already implemented. It's tracked by Malaffi. It's tracked by DOH. And the utilization of data, it's basically all monitored. Everything is tracked and traced. The main goal is that we want to utilize data in order to enhance the healthcare of the population in a safe and a secure way to ensure the privacy for everyone is basically well maintained. We want to use the AI as a tool in order to have better care. We don't, we don't look to the AIs that it's a way to, let's say, replace physician. It's a way to support the healthcare provider. It's a way to identify us, or to identify for us which patient we need to focus on, which patient we need to give him more care, which patient we need to follow on him. So it's a kind of a supporting tool in order to enhance the level of care within the Abu Dhabi ecosystem. Thank you.
That's great, Dr. Bakr. Thank you so much. Thank you so much. We will be concluding our panel. Thanks a lot, Dr. Bakr. Thanks a lot, Dr. Mohammed. That was great, insightful. We wish that this was physical so we can give you a nice warm of applause. The only thing that we could do is a virtual upload right now. That's the only thing that could be done. Thank you so much. We will look at the questions and answers. So we would also kindly invite you to look at, thank you so much for everyone who is uploading. We would kindly invite you to scan the QR code. This is to leave your feedback beyond this session. We would love to hear from you. Rishma, I'll be looking at the questions and I would seek your assistance in looking at everyone who's raising their hands. We'll take a few questions, then you can take care of everyone who's raising their hands. Apologies for getting late a bit for looking at the questions. We'll start with a few questions on the chat from Mr. Stephen, where we have a question that to use the standard international unit for both imperial and standard. Okay, great. So the standardization of the unit is something that's being looked at. It was done in two phases. The first phase was the LOINC standardization. And as you know, LOINC use a unique code per the unit of measurements. This is something that we are working with the Department of Health for. At some point, we hope that we will have a mandate to utilize only standard international unit. For the meantime, we are taking it in a step-by-step. We did first the LOINC standardization, which means that now we have a unique code of LOINC for either a conventional unit or a standard international unit, as LOINC have different codes for each and every unit. Hopefully soon you will have this mandate. From Ms. Fatima. Incorporate IFHAS comprehensive screening result into the patient wellness? The answer is yes. This is on the pipeline as an enhancement of the patient wellness. In case of a discrepancy in the gestational age between facilities, which one will the HIE capture? I love these questions, and I would like to make a shout out to one of our brilliant people in Malaffi. His name is Abdurrahman Zukari. He is a member of our data and analytics team. We managed to create a model that looks at all the clinical data that is being sent to Malaffi in terms of the obstetric journeys. We give them a different confidence level depending on the repetition. So as an example, if we get more data that says that the lady is beyond that particular gestational age, and from the other facility it's a bit far, we use our own model in terms of have a proper, accurate estimated gestational age, deriving the estimated start date and time of pregnancy and estimated date of delivery. So we do take care of this on a confidence level. And what we show is things that we are in a high confidence for, that we have enough data to predict the confidence if we have any discrepancy from the facilities. Shout out again to Abdurrahman Zukari. This wouldn't have been possible without him being part of the Malaffi team. How do we deal with incorrect or retracted information? If there is an incorrect information in our HL7 specs, we primarily look at three actions: add, update, and then the in error, similar to the functionalities of the EMR. So whenever there is an information that is sent to us in error, the facilities send a correction for it. And then in Malaffi, you will see that there is a status of the result that says correction to result, which telling you that that result is not the first version, it's the second version, and you will have a navigation to do for the versioning, and the status will say correction to result. Sometimes patient recent admission will not be shown by Malaffi, some labs done by home dialysis. In those cases, we would encourage you to follow the Malaffi support process. Whenever there is a data that is not available in Malaffi, please raise a ticket internally to your IT team. They reach out to us and raise a ticket, and we investigate the case. If in case that we have a facility that for some technical reason their messages got rejected or they went idle, we have our own process for rejected messages and for idle messages. And then we communicate with the facility to mitigate the issues. Before I go to the next question, Rishma, anyone raised their hand that we need to enable the mic for? I'll leave it to you.
I'm watching the chats at the moment, Dr. Mustafa. There's no one raising their hand, so you can continue.
Okay, great, thank you so much. From Alok, I think we really need an AI tool to summarize the long stay of the patient. Yes, and this is one of the major use cases of the AI physician assistant that you have right now. You could ask the questions in your narrative way to look at recent inpatient encounter. that are having a length of stay above, as an example, 20 days and 30 days. And then the LLM itself, the large language model, the chatbot itself, will be able to summarize it for you. So this use case, it's primarily available now. In terms of the discharge summaries and the medical reports, as we speak right now, there is a limitation of the physician LLM, and we would love for you also to look at the training materials, not the training materials, the training videos that we have around the LLM. So right now there is a limitation that the LLM does not look at the content of the clinical documents. So this is not yet is there. However, in terms of summarization, this is the epitome and the primary use case for it. Export collated sequential data. We do have a printing functionality for the result itself and for the lab result and for the radiology reports. So you wouldn't be able to export the whole medical record of the patients. That should go through a proper governance use case. However, in terms of printing, the functionality is there. And it was actually added as a part of a feedback of the provider. So the printing was a feedback that we got from provider and we implement. Hence, we really encourage you, scan the QR code, leave us a feedback about Malaffi, what features you think is important. Rishma, Suzanne, myself, and the rest of the team will be more than happy to have a look at it, develop a use cases around it, and potentially primarily maybe implement a feature suggested to the Department of Health based on the market feedback. I have personally tried to use the LLM based on a published guide. The chat box opens, however, the disclaimer doesn't show up and doesn't take me to the next stage. That's unfortunate, unfortunately, but we are enhancing the guidelines in terms of the utilization of the LLM. So soon it will be empowered by nice, good clinical stuff. We will announce this once it is on time and it's live. However, rest assured for this. But again, if there is any technical difficulty, sometimes the issue could be from your side in terms of the network, and sometimes could be from our side. The rule of thumb when it comes to the support is log a ticket to your internal team, they investigate, no issues, they will send it to us, and we make sure to have it on time. Rishma, would you like to take the next questions? The ethical and regulatory guidance from patient confidentiality. If you are able to locate that question.
I'm trying to locate the question. I've been watching the screen.
No worries, no worries. I can take care of it. Ethical and regulatory guidance. This was clarified by Dr. Bakr, thanks to him as a part of the panel discussion, where he spoke about the audit, spoke about the different user roles. I hope this was satisfactory, Alok. In case that you need more information, please scan the QR code, leave us your feedback and questions, and we'll be more than happy to get back to you. Mr. Hazm, I represent a healthcare solution for collaboration in such a project. To whom shall we connect? In terms of such cases, we don't much engage in terms of a healthcare solution. In terms of a Malaffi, our main engagement is from an EMR vendor perspective through the participant themselves. So if you are an approach, or if you have a healthcare facilities that is connected to you and you need that connection to Malaffi, you can reach to us in the Malaffi in the onboarding. I would ask gently, Rishma, if you can just leave the onboarding team email on the chat, and you can reach out to them in case that you are managing healthcare providers that needs any connectivity from Malaffi, or you have any questions when it comes to this, and then we can take it forward from the process. ROI.
Dr. Mustafa.
Yes.
Sorry. We have a question for Dr. Bakr, one of our panelists. From a Dr. Karim Idris. He'd like to know if an AI system recommends one course of action, but a clinician believes another is safer, who should have the final authority? Dr. Bakr, that question's for you.
Well, the short answer is basically the physician. The AI is a tool. The AI is a tool. Think about it as your virtual assistant. It will help you in your clinical decision, help you to do a summary for you, to get you all the needed information in order to make your informed decision. At the end of the day, You as a physician, you are licensed by the Department of Health, and you need to take the informed decision based on the information that you have. So you take the AI, take his insight. Of course, you take a decision based on the approved and guidelines of the OH and the international guidelines. I hope that answered.
Thank you, Dr. Bakr.
Reshma, shall I continue with the rest of the questions?
I'm just thinking maybe we can just do one more, Dr. Mustafa, for the sake of time.
Okay, great. We will get back to the rest of the questions on chat. We'll try to answer most of the questions, but Dr. Bakr, I see your hand raised. Please go ahead.
Well, just a comment at the end of this session. Thanks to Malaffi and the other team who work on this. My message to my fellow physicians and all the clinical people here that please utilize Malaffi, please utilize the tools. We are putting for you tools in order to facilitate your work, to enhance the level of care. Use the wellness page, use the AI tool, try it. If you find any issue, please notify it to us, but it's a tool to support you. We as a Department of Health, we are looking for better adoption. We are tracking your adoption in general, but basically we are looking for better utilization of the AI supporting tool, and we are pushing for it. If there is any enhancement you want or you think that will lead to a better adoption, please let us know. We will happy to discuss it and build it in future. Thank you.
That's great, Dr. Bakr. Thank you so much. We do have a lot of questions. That's great. Unfortunately, we don't want to keep everyone, to be honest, beyond the 2 p.m. mark. We will try to get back to you on those questions on the chat. However, we would love to hear it back from you from the QR codes. That will help us get back to you better. Because I have seen mix of questions. They are marvelous questions. I have seen suggestions as well in terms of what functionalities we could put in Malaffi. Without further ado, I would love to thank Reshma for co-chairing today's session with me. I would love to thank Dr. Muhammad from MediClinic. Thank you so much for sharing this insights. Great experience. Dr. Bakr, thank you so much. As always, a pleasure, from the Department of Health. Ms. Suzanne, our head of the Health Informatics, thank you so much for attending this. For everyone who decided to spend this afternoon with us, thank you so much. It was a pleasure having you. I will repeat it again and again. Please scan the QR code, reach out to us with your feedback, with your suggestion. This is something that we take it close to the heart. We are in the end trying to serve the healthcare providers of Abu Dhabi with the best possible. We would love to hear your thoughts. Would love to hear your insights. I wish you great remaining of the day, great afternoon, great evening, and we'll see you inshallah in the next forum. Thanks everyone. Peace out and Assalamu alaikum.